So hi, my name is Martyna Erskine. I'm a family nurse practitioner. I'm working here at Joy Wellness Partners, and I'm going to talk today about the regenerative solution that we offer here at the clinic. Overview about what we're going to talk about today. So we're going to talk about platelet-rich plasma, which is PRP. We're going to talk about A2M, which stands for alpha-2 macroglobulin. And we're going to talk about bone marrow concentrate and also about nerve hydrodissection. So let's talk first, what is the injury? So injury is when our tissue are injured, there's like a hole in it, there's missing fibers, like breakage of the fibers, breakage of the proteins, and our body starts healing process. However, very often we don't have adequate amount of tissues and cells to repair. So regenerative solution, what they do, they have a concentration of our own natural healing proteins to kind of potentiate the healing and make it better and speed it up as well. They provide more robust healing of damaged tissue and aids growth, repair by accelerating the body's natural healing mechanisms. So let's see first what we actually have in our blood. So the main components of blood are red blood cells, white blood cells, platelets, and plasma. Like we know, red blood cells have hemoglobin, they carry oxygen around our body. White blood cells are responsible for fighting any diseases or infections. Platelets are responsible for clotting, but also we found out that platelets carry a lot of growth factors that actually potentiate tissue healing. And plasma is like this water solution when all those substances are merged in. Plasma also it's mostly water, but has some proteins like albumin or 6-hormone-binding globulins. Those are proteins that carry a lot of hormones in our body, has a lot of electrolytes, sodium, potassium, calcium chloride, has other proteins that we will talk about later, and also some gases. What is platelet-rich plasma? So platelet-rich plasma, it's a solution of our plasma and platelets in it, and the platelets contain growth factors, some signaling molecules, and plasma proteins. It's extracted from our own blood, and it stimulates regeneration of cells, helps heal common injuries. So PRP, what does it do? It brings our own body to heal itself by just increasing, not only giving you the growth factors, but also increasing your own growth factors. What is it used for? It's used for many different reasons, to heal any injuries and avoid surgeries, to help with pain, help with any repair processes of damaged tissue in our body. A lot of athletes use PRP to recover faster from any injuries. Instead of waiting for the body to heal itself, they use PRP to heal faster, and they use PRP to heal completely. So what is the healing process? Healing process is the natural process when we send our own platelets and then our own growth factors from the blood to damaged tissue to initiate the healing. And the platelets actually have a lot of growth factors in it that are also released in a site of injury through cell signaling. So there's two things we can get those growth factors. We can initiate their production at the site of the injury, but we can also increase the growth factors number by injecting them, extracting them from our blood and injecting them directly to the site of the injury. So this is just like a fun fact about healing phase. So like you see, the first part of the healing process is inflammation. This is when our tissues are very sore. This is when usually everything gets like swollen and painful, but that's the inflammation is the first step of healing. So it's we call it the good inflammation. Once the inflammation, slowly subsides, then proliferation takes over. And proliferation, it's like a new rebuilding of new tissue, taking the collagen, taking extracellular matrix, and rebuilding those tissues. And once you rebuild those and patch those holes after many like months, the tissues start remodeling. So how the PRP process look like? First, we of course draw your blood around 30 to 60 ml. It depends on the site of the injury, how big it is. Here for a regenerative solution, most of the time we do 60 ml. just to have a good amount of platelets. We centrifuge our PRP twice, our blood twice. First, we get PRP with PPP, which is platelet poor plasma. So we spin them again, and then we separate PPP, platelet poor plasma, from PRP, platelet rich plasma. And then there's like much thicker, we have smaller amount of it, but it's much thicker and a much stronger solution. So it's not diluted. And then we inject it to any injuries, any tissue that needs it. All our injections are ultrasound guided. So what is PRP used for? It's used for so many different things. It's used in tissues to help with any tennis elbow, hip labrum, shoulder labrum, tears, bursitis, tendinopathy, tendonitis, and the rotator cuff tears, or any muscle, ligaments tears, anything like that. In the spine, we can use it in a disc, so we can inject it in a bulging disc, or when people have degenerative disc disease, we can inject it there to help the disc repair, hydrate the disc as well. We use it for facet joints around the spine. We use it for SI joint dysfunction. In osteoarthritis, we use it for any like a joint diseases, a joint issue, which is osteoarthritis. That's the disease when we are losing the cartilage in our joints, and then like knee, hips, shoulders, hands, ankles, any type of joint. And also we can use it for a bone, and this is when we actually inject PRP directly to the bone. We use like a special needle that can penetrate the bone, and we can inject it right when there's like a breakage, or we can just do it all around it to help it heal from the outside too. What are the application in aesthetics world? So we use it for hair loss. We can inject it into your scalp right under the hair follicles to stimulate a specialized population of cells that are called dermal papilla cells. And they are responsible for hair growth. So that helps with restore thickness to existing hair, provide natural way to treat the common issue of hair loss. So for a PRP for hair loss, it's very important to have the hair when you do it. So even if it's like a small little like a peach fuzz or a thinning hair, this is when it's gonna work, because it's gonna work on those follicles there to grow more hair and grow stronger, better hair. However, when people are totally bald and they don't have the hair follicles anymore, and they have this like a shiny skin on the scalp, that's unfortunately too late, because it works on the hair follicles, so they have to be there to work. In a clinic, we also use PRP for vampire facial. This is when we do the same thing. We draw your blood, we spin it, and then we use a microneedling device to microneedle PRP in your face. And that's amazing for any fine lines, fine wrinkles. Helps with enlarged pores, really nicely shrink the enlarged pores. We use it for a lot of scars too, like post-acne scars, to smooth it up the face. It's like microneedling, however, it's like 3 times more powerful. So you don't have to do as many microneedling you can do with PRP, and it's just a result that's so much better, brings a lot of collagen to the tissue and helps smooth out the skin and minimize any damage caused by sun. Also here at J1's Partners, we use PRP for some sexual issues for females and males. So we perform a treatment called OSHAT. OSHAT, another name for its organs shot. This is when we actually inject PRP in a vaginal wall, like anterior vaginal wall, when the G-spot is, and the clitoris. To help women enhance their sexual experience. We have a lot of women that actually do it just because they never had the orgasm before, or they did have it, but now they're going through menopause and they have a dryness there and an urinary incontinence, and they just want to strengthen those walls, especially after giving birth, when all the tissue get damaged there and we have a lot of scarring and the skin or muscles are not as tight as they should be. That really tightens them. What does it do? Basically enhances sexual function, improves blood flow to the area, strengthens and increases vaginal wall, and then decreases urinary incontinence, may even help with lichen sclerosis for a lot of women, and it helps with lubrication as well. And the P-shot. P-shot is the same, but it's for a man. It's also called prepuce shot, and it's also enhances male sexual function. We do injection the same like for female, but we do in the top of the penis, and restores proper blood flow and stimulates new tissue growth. So brings more vessels, and then that causes also new vascularization, which is formation of new vessels. So more vessels in area, the more the blood flow, the better the erection and the better the sensation. And there's basically no side effects to any of those treatments. Recovery time, it's just maybe a few hours. We just say be careful that day, you know, maybe don't go in any dirty water, just take a shower, don't go in the ocean, and the next day you basically good to go. The reasons why we see men for the P shots is to enhance their sexual function, to improve the blood flow there, strengthen and increase the erection, increase even thickness and length, and we see that happening. So A2M, what's A2M? A2M is alpha-2 microglobulin that is naturally occurring autologous, which is mean our own protein found in platelet-poor plasma. So we use it for joint injections here at Joe Wellness Partners. It's the best treatment for osteoarthritis and all for osteoarthritis prevention. It's our own master anti-inflammatory protein. So it really lowers the inflammation. So what is osteoarthritis? It's actually the cartilage disease. It's when our body is overproducing chemicals that erode cartilage. And those chemicals, which are proteases, they break down proteins and they break down our cartilage. So A2M basically can stop progression of osteoarthritis by stopping and inhibiting those proteases. So this is like an example of the normal joint, and this is how the osteoarthritis look like. We have worn cartilage, we have some bone spurs, and like all of this, all of the joint is inflamed. Two main things that A2M does: it's anti-inflammatory, which is really important in stopping osteoarthritis, block inflammation naturally, relieve pain, prevent cartilage breakdown. And this way stopping arthritis by lowering inflammation, and also stops osteoarthritis by inhibiting protease, which is the enzymes responsible for breaking down the cartilage. So this is how the A2M process look like. That's how we used to do it. You basically attached your PRP, the same, you draw your blood, you spin it, you obtain a PRP. So you separate platelet poor and platelet rich plasma from the blood. Like red blood cells, white blood cells, and all of that. And you attach that to this special filter, and then you go, and then you attach the other syringe on the right that it's empty, and then you attach a syringe on the top here, and then you draw it up, produce a vacuum here, and you basically swoosh PPP from one syringe to the other, and this filter separates the protein, A2M protein, from the rest of the blood. And this is where it's collected. So that's how we used to do. This is how we do nowadays. We have the special machine for it. We'll draw around 160 to 180 cc. Usually it's 120 cc of a blood, depending on the area we're treating. And then we spin it in a centrifuge, and then we separate platelet-rich plasma from the platelet-poor plasma. So first we spin it, then we have on the top platelet-poor plasma, on the bottom platelet-rich plasma. So what we actually this time want, not the platelet-rich plasma, but we actually want the poor plasma from the top. And then we just inject it in one of this bag here, and the machine separates A2M from the rest of the ingredients in the plasma. And once it's collected, then we draw it up and inject in a joint. And those injections also are ultrasound guided and go straight to the knee joint or straight to the shoulder joint, wherever people start having osteoarthritis and they want to stop its progression. The application of A2M stop progression of osteoarthritis, promote healing, repair, support the restoration of affected joints, stop the breakdown of cartilage and prevent cartilage loss, reduces pain, because reduces inflammation, and inflammation is a pain, and improve joint function. So do you have to do it when you have osteoarthritis? No, not necessarily. If you have osteoarthritis running in your family and you feel like you're gonna get it because your mom has it, your dad has it, and your joints start feeling like not the best as they used to be, you can do A2M to prevent osteoarthritis formation. And the next thing, next regenerative solution that we offer here at the clinic, it's a bone marrow aspirate concentrate. Like the name says, we take it from your bone marrow, and it's autologous, which means it's from your own, obtained from the same individual. So it's like getting a stem cells, however, your own stem cells. So what's in a bone marrow aspirate concentrate? It has mesenchymal stem cells, mesenchymal stromal cells, has some platelets, has monocytes, lymphocytes. Those are all different types of white blood cells. Has some HSCs in it and many different plasma proteins. That's how we obtain it. We go with the special needle. It's all ultrasound guided, obviously. We go with the special needle that can kind of drill through the bone. Once we get there, we take the sharp part off and we put this like a blunt, thicker needle that has little holes on the side, and we just aspirate the bone marrow from different levels of the bone. That's how it looked like after we obtained the bone marrow, and we do it the same. We use it for the same purposes as the platelet-rich plasma, but instead of just having platelets, which are growth factors, it has actually those mesenchymal cells that are our own natural stem cells. What's in it? It contains healing stem cells that signal for a robust healing of damaged tissue. It aids growth, repair, accelerates, which speeds up the body's natural healing mechanisms, acts as a chemoattractant. It signals additional healing factors to the site of the injury. So it's not only healing at the injury site, but also attracts other growth factors in our body to come to the area and heal it additionally, and helps to relieve pain, reduces swelling, and enhance healing of the articular cartilage, discs, and bone. So what are those mesenchymal stem cells? That's what differentiates bone marrow from PRP that has those mesenchymal stem cells. So those are cells that can differentiate, which means they can change into any variety cell types that we need, like into cartilage. They can switch and become a cartilage cells, or they can become connective tissue. They can become a bone. So really, they're kind of like the baby cells that can turn into wherever we want, wherever we inject them to. And the last thing that do here in the clinic, it's nerve hydrodissection. It's not necessarily so much regenerative solution. It's more like a physical kinetic type of help for an pinched, squeeze out nerves that hurts. However, in our hydrodissection solution, we put some B12 that we know B12, it's really good to regenerate nerves, and some other growth factors to our nerve hydrodissection solution, so become more regenerative solution, not just the normal saline with dextrose. So it's basically ultrasound guided injection of a fluid that has those mixes of B12 and some other electrolytes. And we inject it all around the nerve, because very often we have a pain because the fascia, that is the layer between our muscles, when there's some injury to our muscles, tendons, ligaments, the fascia gets more sticky, pulls on those nerves and kind of like entraps them. And the nerves feel very like, and every time we move or constrict those muscles, the fascia is pulling on the nerve left and right, and the nerve hurts, and that's called nerve impingement. So what we do ultrasound guided injections into the fascia to kind of separate the fascia and separate the side of the injury from the nerve, so the nerve can run through it. So it's like decompresses the nerve, and the nerve can move freely. And then once the nerve can move freely, there's more blood flow to the nerve to helps rejuvenate it and heal it as well. And that's how it will look like under ultrasound. So this is like a nerve, this is like the needle, and then this is a solution that is injected all around the nerve to kind of like nicely open up the space around the nerve to help with the blood flow and entrapment. And this is like a simplified picture, how it look like basically that we just inject that fluid around the nerve. And then when the nerve is big like that, it's usually the angry nerve. That's the nerve that is really impinged. Once there's a lot of friction and rubbing on the nerves get bigger. So when we can see like a big nerve under ultrasound, we can say like, oh, this looks like a really angry nerve. So yep, that's a hydrodissection. Thank you for listening. If you have any question, you can type it in a chat. I'll try to answer them right now. If you don't have any question, but you can think about them later, you can send them to us via email at info@jwellnesspartners.com and we'll try to answer. Somebody asked, like, how do you know which treatment to use? So the best way to find out is to do ultrasound exam with our doctor that specialized in musculoskeletal exam. Once he puts probe on you, he can exactly tell you what it is. If it's like there's no tissue damage, there is no, he doesn't see any tear muscle, ligaments, but the pain is there, it's probably just entrapped nerve, and all we have to do is the nerve hydrodissection. However, if we see some tissue damage, some tears, then we can think about PRP or bone marrow concentrate. If you want to do it for preventative reason, or if you have a pain in your joints and you have at the beginning of osteoarthritis, which is like the condition bone on bone, then A2M will be the best. So it's good to start with the diagnostic exam. What is lichen sclerosis? How do I know if I have it? So lichen sclerosis, it's like a condition. We do the OSHAT for it. You know, if you have it, if your skin, it can happen after giving birth, after the trauma of giving birth, or it can happen naturally because of the inflammation in your body. If it's when your skin, it's like very taut and very inflexible, becomes hardened, and it's really painful for you to have a sexual intercourse. You can come, we can like do assessment and see if that's something you have, and we can suggest to do the OSHAT, or you can, you know, just think about it. Would I need more than one of these treatments? So it depends of the size of the injury. If it's like a full thickness tear, then sometimes people need 2 to 3 treatments of PRP. Bone marrow, it's a little bit more powerful. So usually you need 1 treatment of bone marrow compared to 2 to 3 treatment of PRP. You can feel more discomfort with bone marrow just because we have to take it from the bone. We numb patients so they don't really feel that procedure. Does bone marrow collection hurt? Somebody asked. It shouldn't hurt. So what it hurts, it can be a tiny little pinch when you feel at the beginning when we inject numbing solution, and after that you should be numb. So people should not feel the extraction of the bone marrow. Are most of the problems you mentioned able to be treated with regenerative options without surgery? Yes, actually, most of the treatments, most of the conditions can be treated with regenerative solution. Obviously, if you will come for an exam and then your tissue or like bunch of ligaments are already gone, or if you have totally bone on bone and you don't have any cartilage, we're not gonna be like, oh yeah, let's inject a regenerative solution and see what's happened. Like, unfortunately, some of the conditions are so, the progress of it, it's so far that sometimes surgery is the only option, but it's worth to check it. You know, if it's not too late, it's worth to do regenerative solution instead of going under the knife, because, you know, when the surgery takes place, a lot of tissue has to be cut to get to the spot of the injury, and then the healing process takes a very long time. And once you start healing, you can have a lot of scar tissue forming in the place when the surgery took place, and a lot of adhesion and a lot of pulling on it, and people very often have a more nerve pain after surgery. So it's really, if you can avoid surgery, it's better to do it that way. And then after ultrasound exam, we can exactly tell you if you're a candidate for regenerative solutions, or you should consider a surgery. So how do you start? The best way to start, it's called Join Wellness Partner and schedule the ultrasound exam. After ultrasound exam, we can sit down with you and tell you what we see. We can give you the whole report, what we see under ultrasound. And then based on that and pricing, you can decide what's the best option for you. What about peptides? I have heard they can sometimes be used along with regenerative options. Yes, peptides can be used. We offer some peptides. Not all of them are right now FDA approved. However, some of the peptides are the FDA approved, and we can add them to hydrodissection solution. We can add them to PRP solution or bone marrow solutions. Okay, looks like that's all. Thank you guys so much. It was great to talk to you. If you have an additional question, like I said, you can email us at info@jwellnesspartners.com. My name is Martyna Erskine, and thank you so much for listening. Have a wonderful day.